When patients come back with a positive tuberculosis skin test or a positive blood test, they often wonder what's next. The important dividing line with tuberculosis is whether you're having any symptoms or not, such as a cough, especially if you're coughing up blood, or if you're having night sweats or generalized symptoms like fatigue. Any of these would be a sign that you have active tuberculosis. If there's a suspicion that you have active tuberculosis, then they'll also ask you to produce a sputum sample, which will be sent to the lab to be tested for tuberculosis germs. It takes about a month to complete the testing, and if it comes back positive, then you'll need to be treated for tuberculosis. You need treatment for 1 year, but in some cases you might need treatment for as long as 18 months. The treatment is usually just isoniazid, one antibiotic by itself, but if you're in an area of the country or you come from a country where there's resistant tuberculosis, then you might need to be treated with 2, 3, or even 4 antibiotics to make sure the tuberculosis is under control. The bad news is, if you have active tuberculosis, you must complete the treatment before you can go ahead with your USCIS paperwork. So this could mean a delay of up to 1 year to 18 months before you're able to finish. Fortunately, the people who need to do this are very few. I've only had 1 or 2 people who have needed this out of more than 1,000 patients that I've taken care of. In most cases, people have what we call latent tuberculosis. It means that people have been exposed to tuberculosis, but they do not have an active infection. They are often treated with just 1 antibiotic. Again, the most common one is isoniazid. However, sometimes we decide to treat them with 2 or 3 antibiotics just to make sure the tuberculosis is under control. You need to take the treatment for an entire 6-month period. However, once you begin the treatment, you can go ahead and complete your paperwork. This means you only have a 1 to 2 week delay in completing your paperwork, unlike the people with active tuberculosis who have to wait an entire year to complete the treatment before they can proceed. If you have any questions about this, you should discuss it with your civil surgeon